Welcome back to Colorado and Company. We begin with a topic that may be too sensitive for young viewers. It's a silent struggle which many women face, undesired cosmetic appearance of their intimate areas. You know what I'm talking about? Women may have these concerns as teenagers or in their 30s and 40s, even into menopause. Having children, well, also that may result in unwanted vaginal changes, including loss of sensation and incontinence. These problems can have a lasting effect on a woman emotionally and with intimacy. Dr. Oscar Aguirre is an internationally recognized board-certified gynecologist. He is fellowship trained in urogynecology with over 10 years of experience in reconstructive and cosmetic vaginal surgery. He is an accomplished urogynecologist who specializes in cosmetic surgery, treating women with urinary incontinence and other intimate issues. Now he's joined by Letha Heitman, Dr. Aguirre's patient coordinator, and Nicole Bingham, one of his patients. Hi, how are you?
Good, how are you?
Good.
Thanks for having us.
Thank you for coming on the show and talking about this.
Thank
I know
you.
sometimes this can be a little sensitive, but a lot of women watch this show and this is an important topic.
Yes.
So let's learn a little bit about your background and why you decided to choose this particular field, Doctor.
Sure. Well, as you said, I'm a urogynecologist, and what that deals with is women who come to see me with urinary incontinence and vaginal changes that may occur after childbirth. But with that comes many women who have concerns with the appearance of their intimate area, whether it's their vagina, whether it's their labia. And so it was natural for me to get additional training and become an expert in cosmetic vaginal surgery.
Okay, so there's a lot going on there resulted from pregnancy, childbirth, as we said earlier, hormones. Address the solutions.
Sure. So, well, as a pelvic surgeon, many changes that occur following vaginal delivery may be affecting the way their bladder works or their bowels work. There could be vaginal relaxation, vaginal looseness. And so some of those treatments are, we begin with maybe some physical therapy towards surgery. Some of the other changes that occur, even with just simply aging, would be the way the vagina actually looks to the patients. And so they may be bothered by large labia or other things that occur with either aging or pregnancy.
What do women experience with urinary incontinence?
Yeah, so it's the loss of urine or the loss of control of the bladder that may occur with exercise, or maybe if they have a lot of urgency frequency. So there are some, and once again, some of the treatments are conservative to surgical. There are some surgical treatments like a TVT sling to address incontinence, or some other more advanced surgeries such as some medications and some hormonal therapies too.
So you could be going to Pilates class or something as a woman, and then something like that could happen. So
yeah, and so that would be stress incontinence.
Stress,
It's
okay.
the leakage with activity.
And as a cosmetic surgeon, there are some common reasons why women come to you besides urinary incontinence.
Sure. So these women these are patients that I have vary anywhere from their 20s to their 70s. And if they're coming to see me with incontinence, they also have noticed changes that occur with their bodies, whether it's excess fatty areas, whether it's extra fat around their abdomen or their thighs. Last month we talked about liposuction that we do in the office as a cosmetic procedure, but also more intimate changes that occur. So labiaplasties, vaginoplasties.
Okay, and Letha, describe your typical patient to me.
That's a great question, Denise. You know, we've had mothers call us with a daughter of age 13 that has experienced some change in their labia, and it's through adolescence of puberty, and they're being teased in gym class. So we've worked on young women from the age in their teens all the way up to moms after they've had babies, to women after they've had menopause. So all ages of women, we come to us for services.
Okay, you can call 303-223-6162 and describe a typical consultation when someone makes an appointment to come in.
When they call with bones, you know, idealistically would be to bring them in and meet with Dr. Aguirre and receive a one-on-one consultation. You know, privacy is ingrained in our office, so we respect that with the situation and the nature of what the women are coming in for and want to keep them comfortable. If they have questions as the coordinator, that's where I'm very proud to be able to speak to these women and take what's an uncomfortable conversation and make them comfortable with it and let them know that many women suffer with the same. As you know, Nicole is a young lady that experienced change at a young age and is a good typical patient of somebody that as she got older found that it was bothersome to her and sought help, and then found that it was somebody like us that could take care of that. And it's very proud for me to be able to be there to do that for these women.
Well, Nicole, thanks for coming on the show. It takes guts, girl, to come out here and describe and tell
pleasure.
everybody.
I'm here because I'm hoping that I really could help other women just take that first step.
Right.
And coming in to see Dr. Aguirre. You know, this is a very touchy subject. Women are embarrassed, a little scared, but I hope if the women that are watching this today get that courage to come in for a consultation and, you know, put it out on the table and ask Dr. Aguirre for help. And that's exactly what I did. It took me many years to find that courage, and it took me many years to find Dr. Aguirre. And after having my consultation and my procedure, it has changed my life immensely.
Okay, so tell me about your experience and why you went to go see Dr. Aguirre.
Well, first off, I had a very large labia. The intimate area was not pretty for me. It didn't match the rest of me, I guess I want to say. I like to take good care of myself, my appearance. So this didn't match this, and it started at a very young age, I guess, going through adolescence and growing up. It bothered me. It showed through swimsuits. Intimately, I was a little bit inhibited to be with a partner. And then finding Dr. Aguirre, coming into the office for a consultation, he makes you feel so comfortable. He's there to, you know, talk with you, tell me what your concerns are. He makes you just feel relaxed. Because it is such a personal thing for a woman, and the staff in the office is fantastic. The whole, from start to finish, it's incredible, and the outcome is ever changing. Your life has changed.
And you can't wait for the summer, because you're going to be walking around in that bathing suit not worrying about it anymore, right?
Yes.
All right. And that has to make you feel good, too, to have a client like that sit here and say, hey, it bothered me from when I was younger, and it's something that I felt comfortable with this doctor, it's taken care of, and now I can move on with my life.
Well, sure. I mean, my big interest in this started with a patient just like Nicole, even seeing them at a much younger age. And they would go to their physicians, to their gynecologists, and really they weren't given a solution. And so being able to change someone's life like this has been wonderful.
You have a free educational seminar that's coming up. Give me the details on that.
Sure. That's actually next week on the 24th at my office. We'll be talking about all the non-surgical and surgical options that women have for vaginal rejuvenation, which could include vaginoplasties or labiaplasty like what Nicole had, or a G-spot augmentation to improve sexual pleasure. And with that, we'll also talk about other procedures that we do, whether it's liposuction or other complete line of dermal aesthetics that we do in the office as well.
Nicole, how long was recovery for you? Was it very painful?
It wasn't. What kind of bothered me was I stayed awake through the whole procedure and actually would speak with Dr. Aguirre while the procedure was going on.
Wow.
What bothered me the most was just actually my hips from the position that you're in for quite some time during the procedure, but afterwards, you know, he goes over the specific instructions for you on how to care for yourself. It is a little bit uncomfortable because obviously it's, you know, the area where it is, but you know, you're told how to take care of everything, and I would say just a few weeks of sensitivity there.
Okay. How long should a woman plan to take off of work, or is there any downtime that they need to consider?
Yeah, you know,
Lita can address that.
absolutely. You know, educating patients is so important and so dear to us in the practice, and including myself. And that's, you know, we've had many women have this done and actually be back to work within a few days. You know, realistically, they realize that there's going to be some soreness involved, but no extreme pain by any matter. As for sexual activity, resuming, you know, heavy duty weightlifting, you know, we have the patient wait 6 weeks, but to get back to work, they could be back to work within a few days.
Excellent. And doctor, I know this is your second appearance on Colorado and Company, but we're gonna, it's part of 3, so you have one more coming up, and hopefully even more than that, to have you on the show to talk about these serious subjects for our female viewers. What's going to be your next show? What are you gonna focus on?
Next month we'll focus on another option for vaginal rejuvenation, that's vaginal tightening. And that's, so there are changes that occur following vaginal deliveries. that women will notice a lack of sensation or a decreased sensation. And so we'll focus on that, and we plan to have a patient also for that.
Very good. And you're also a Moms Like Me expert, too. You're going to do a live chat in March?
Yeah,
Yes, we are.
that should be fun. So in March, actually, March 1st and 2nd, what we'll be doing is Ask the Expert, and it's vaginal rejuvenation and how it affects moms after babies. So that's a very interactive exchange over a 2-day period of answering questions over the email, and both Letha and I will be responding.
Great. And if you haven't heard of Moms Like Me, you can go to momslikeme.com. It's another great website, another great resource that 9 News and Colorado and Company offers. So thank you for taking part in that. That's wonderful.
We love it.
And you also believe in the concept of paying it forward. So tell me about that.
Of course. As a pelvic surgeon, what I see a lot is women who have issues with their pelvic region, so whether it's urgency, frequency, bladder pain. And those women, often the sad story in their history is that they've often been sexually abused as children. So I'm a big believer in giving back to the community, and especially the proceeds from the surgeries that and consultations that we get from the COCO viewers. A percentage of that will go to the Kemp Foundation to support that cause regarding childhood abuse, sexual abuse.
Well, wonderful. Thank you for doing that.
You're welcome.
That's great. Yeah, and it was a pleasure having you all on the show.
Oh, it's been a
Girl,
delight.
thanks for sharing your story.
Absolutely.
I'm serious.
It's my
Takes guts to
pleasure.
come up
She's
here and do
amazing.
it, and I'm glad you did. Aguirre Specialty Care is a center of excellence for women, really providing everything from urogynecology and cosmetic gynecology to body contouring and dermal aesthetics. And we really encourage you to attend Aguirre Specialty Care Seminar, Intimate Makeover. It's not taboo. It's on Thursday, February 24th at 6 p.m. Dr. Aguirre will be discussing aesthetic vaginal surgery. There will be special seminar-only pricing available. This presentation, free, open to the public, space is limited, so register today by calling this number, 303-223-6162. That's 303-223-6162. Go there, it's free, get those questions answered, you'll be glad you did. And as a special offer to our Colorado and Company viewers, Aguirre Specialty Care is offering a certificate for a complimentary ASC photofacial for each viewer who receives a consultation with Dr. Aguirre. That's a $400 value, but you gotta mention, you saw him on Colorado and Company when you book your appointment. Again, the number, 303-223-6162. Visit ascdenver.com. And again, a percentage of all proceeds generated from COCO viewers' consultations will be donated to the Kemp Foundation. Aguirre Specialty Care paid for this segment.